Every May, we mark National Nurses Week, honoring the men and women in the nursing profession. And we have with us here from Baystate Medical Center, Christopher Bayreuther. He's an emergency department nurse. And Jessica Gottsche, she is a talent acquisition marketing specialist in human resources for Baystate Medical Center. And Jessica, your job, among others, is to make sure you have plenty of nurses at Baystate. Nurses always needed. There's an innovative approach you folks are taking, I understand. Job interviews, informal, no appointment needed, I gather. You're set up for 4 hours every Thursday, lobby of the Daily building, right up there at Baystate Medical Campus. What led you folks to take that approach?
Well, we know, Jim, that as you said, we will always need good qualified nurses throughout our entire health system, and that will be an ongoing need for probably forever. So we had to find a way to reach nurses where they are. We can't always expect them to come to us and apply. So we started a lot of different innovative ways of reaching them. And one of those ways is to promote on social media, primarily Facebook, that we're available every Thursday from 10 to 2 in the Daily lobby for informal interviews. So there's no application needed. A nurse doesn't have to necessarily commit to anything. They can come in and just learn more about nursing at Baystate. If they are qualified at that time, they'll do an interview with the recruiter and an interview with a hiring manager and tour the hospital. So it's kind of one-stop shopping without having to go through the application process. And it gives them an opportunity to learn about us and us to learn about them in a very informal, casual, and really fun setting.
Am I right? There have been some cases where you've hired folks on the spot.
We have. We actually hired Chris on the spot, and we started in November of 2016 with this program, and I think we're up to 15 or 18 registered nurses that we've hired, and really it may not sound like a lot, but that's a lot. That's a lot of nurses.
Christopher Bayreuther, RN, registered nurse. I got to ask you, what led you to, obviously, I suppose there's an attraction to be with the largest medical facility in the region, and one of the largest in the state, but what led you to say, yeah, you know what, I think I'll go take a look. Sounds like a good idea.
Well, I mean, I always kind of want to do something challenging, something, helping people, really. I felt that nursing really kind of expressed, me as a person between, the science of nursing with technology that we have nowadays, all that, and the art of nursing, which is more the compassionate side and the communication side, and really kind of put those together and kind of help people, help them work to better themselves and to, come to our hospitals like Baystate and help them to feel better.
Jessica, we're very proud of the nurses at Baystate, obviously. Everybody is. Your Baystate Medical Center has been identified as a magnet hospital for nursing excellence. It's, again, a nationwide recognition, the American Nurses Credentialing Center. Correct. There are only 9 hospitals in Massachusetts, as I understand it, that have this recognition. Third time in a row, it's happened for Baystate. Just 7% of nursing facilities nationwide get this magnet hospital nursing excellence recognition. What does that mean?
It's really a coup to the nurses' work that we do every day, and also to leaderships and management support of those nurses. So education and professional development is really important to any nurse, as I'm sure Chris would tell you. And our demonstrated educational programs and our assurance of the professional development opportunities that Baystate Health offers is part of what drives our magnet designation. We also really focus on work-life balance and allowing our nurses to kind of own their schedule, which is it's not possible everywhere, but at Baystate we really strive to make that work. And so our nurses have a lot of say in their own schedules and in the work that they do. And by giving them their voice, that's what helps us drive that magnet designation. So as you said, yeah, we've had it now 3 times in a row, which is very rare, and we are incredibly proud of our nurses that they've done that. And it's a huge recruiting tool for us. There are nurses who come to us from all over the country, and they come to Baystate because we're magnet designated.
There really are a great many more opportunities in nursing than I think the average person thinks of. We think of the nurse we see in the hospital ward, caring for the patient. And that's very, very critical, important work where the rubber meets the road, no question about it. but there are management positions, nurse practitioners, clinicians, research, and all of that's possible when you get to a major facility again.
It is absolutely, and you're right, the bedside nurses at Baystate Medical Center are probably the most recognizable, but you know, we have a huge staff of home health nurses who go to homes in our entire Western Mass community and care for patients at home, and of course, you know, a lot of us unfortunately are familiar with hospice nurses, and they do the same when needed. Our community health center nurses are really out there and visible in the communities that they live and work. Our smaller regional hospitals have incredible nursing staffs as well. So there's a ton of opportunities. And some of those professional development I was talking about is finding nurses who come in kind of at the staff level, but they aspire to be management. And we can provide that road for them as well.
And Jessica, I got to ask you, when you talk to people like Christopher, nurses that are coming in and maybe just taking a look and thinking about it, you're hearing the stories, I'm sure, of the dedication to this profession.
And especially at Baystate Health, what is as important to us as your skill set is your compassion and your emotional side and your ability to connect with your patient. You know, at Baystate, we say we deliver a higher state of caring, and that's really the quality side of that, and making sure that we're putting the patient first and we're putting the family first and focused on patient and family-centered care. And we in the recruitment office in human resources can see that a lot more quickly than maybe we see the skill set, because a nurse manager will be able to say, you know, can you do this, this, and this? But we can recognize that compassion, and it's as important as the skills.
Got to ask you one more question, Christopher. You know, when you go in and you're working a shift in ER, you're going to see something pretty difficult pretty much every shift. Once in a while, patients are lost. You do everything you can to save them, to keep them here with us, to keep them with their families. When you do that, when you have that success, no matter how hard the job is, yeah, there's the smile. It's got to be pretty darn satisfying.
It does feel good. Like you said, we can't save everybody, but we do our best to save the ones that we can. You know, we do our best that we can. A lot of the families, like we sometimes in certain situations, there's a side of nursing where we actually can bring the family into the and watch their patients or their family member get worked on, and it kind of helps them cope a little bit, and it helps them to really understand what the situation is going on at that moment in time.
Well, thank you both for coming in. Christopher Bayreuther, RN, and Jessica Gottsche from Human Resources at Baystate Medical Center. Appreciate having you.
Thank you very much.